Historically, in the African American community and in the Hispanic communities, people of color, what we have seen is a great disparity in health care and a great disparity in accessibility to health care. The pandemic has brought that to an even greater light. We need to do all we can do to work with healthcare officials to get the vaccination. It's vitally important for our community. The elderly don't have the ability to go online to sign up for a time slot to get a shot. And then of course accessible vaccines is another thing. And then some of it would be for our elderly also the ability to get to a place to get the shot. So, and I would say there might be some lack of information in terms of what's available, how to sign up, and how to get the vaccine. I think when we hear in Scripture, love one another, we have to look at those ways. It's not just about hugging. It's not just about saying, oh, I love you. But it is about feeding the hungry, clothing the naked. But this is a concrete way that we can show our love, I believe, for one another. And I think in many ways, as we listen to Pope Francis in his letter Fratelli Tutti, how we need to live as brothers and sisters, how we need to work together. This is a prime example of how we as individuals, as faith communities, as a larger community in our city and in our country and in our world can support one another as brothers and sisters by taking the vaccine. This is a deadly disease. I've seen it firsthand. I have gone to the hospital to anoint COVID patients, and I have done funerals for COVID patients, and I know the devastating effect that it has on the individual, but also on the family. The families are crushed during this time because of the pandemic. They're not able to celebrate the life of the person, and many times the death of the person is rather tragic in how they contracted COVID and the subsequent healthcare issues. So first of all, I say, get the shot for yourself, to protect yourself, but also get the shot to protect your families, to protect your loved ones, protect the ones that you care about, to protect your neighbors and those around you, the people that you work with. It's not just about us, it's about all of us. And I think that we have a responsibility to protect ourselves and to protect one another. I took the vaccine, first of all, I need to say that I was a registered nurse before I became a priest. So from a healthcare perspective, it's the right thing to do. It's the right thing to do. But in an immediate perspective, I need to protect my parishioners. I need to protect the people, the many, many people that come to see me or that I minister to. The symptoms that I had after my second shot, I had no symptoms after my first shot, but the symptoms after the second shot, that's a small price to pay. A couple of Tylenol and a little nap was actually what I did. But when I look at that and I look at the patients that I've gone to anoint and are in the ICU, or when I hear some of the people in my parishes talk about having COVID and what they went through and how sick they were and how they couldn't breathe and what that feels like, it's a small price to pay for the protection that I feel I have because of the vaccine. And it is devastating. And the people who are on ventilators, when you see that and when you experience that, you know it's real, you know it's serious, and you know you need to do whatever you need to do in order to protect yourself. It is free. Please take advantage of it. Please sign up. Please get your vaccination for yourself, for your family, for your community, and for the world.